Welcome to SCNM Laboratories Lab Post videos. In this video, we will review exposure incidents and what actions can be taken to reduce the incidence of exposure. Exposure incidents are incidents where someone is exposed to potentially infectious material. This usually happens with blood and is most commonly due to injury from a needle stick. As a common example, a student is administering an IV push to a patient using a butterfly needle. Upon completion of the IV, the student begins the procedure of removing the needle. However, upon removal, the student accidentally sticks her finger with the used needle. It is important, if you are involved in an exposure incident, that you act immediately, because many of the steps taken afterward are most effective the earlier they are initiated. The first step is to address the site of the exposure. The area should be washed or rinsed thoroughly. The exposure should then be immediately reported to the supervisor. Most of the time, for a student, this will be the supervising physician. Depending on the situation, however, this could be the nurse in the IV suite or the laboratory manager. Upon being notified of the exposure, the supervisor will go get the exposure report form and review the events related to the exposure with the exposed individual. On the form is a phone number to Banner Occupational Services. This is the department of Banner which has been contracted by SCNM to handle its exposure incidents. The exposed individual should call that number within 15 minutes of the exposure. Once contacted, Banner will also review the incident with the exposed individual and determine whether or not the person should come in for testing and treatment. If they decide it requires further action, and they usually do, the exposed individual will go to Banner, where they will test for HIV, hepatitis B, and hepatitis C as a baseline. Banner will also offer antiviral treatments. Follow-up is then done at 1 month and then 6 months from the date of the report. The source patient will not be required to go to Banner for testing. Rather, SCNM Laboratory will collect blood from the patient and run the same tests. Once results come in for the source patient, SCNM Lab will forward them to Banner. This policy remains the same for extended sites under SCNM. The only difference with handling an exposure incident at the extended site is that they do not have the capacity to collect and process blood. With that in mind, the source patient has a few options. Most often, the source patient will come to SCNM for collection. Additionally, they may be able to go to LabCorp for the collection. This requires SCNM Lab to enter the order into LabCorp ahead of time, so the lab staff would need to be informed of this event. Third, the source patient may opt to go with the student to Banner for collection. All of these services are a part of SCNM's policy regarding exposures. They are 100% covered, and there is no cost to the exposed individual or the source patient. Now, there are a few basic concepts that, when followed, will help reduce the incidence of exposure. First is to use personal protective equipment where indicated and to the level required by the type of procedure being performed. Examples of this PPE would be gloves, masks, face shields, or disposable gowns. Another aspect is the knowledge of how to use engineering controls. Engineering controls might include safety locks on needles, retractable needles, or sharps containers. It is important to be familiar with the engineering controls that are present with the equipment that is in use, as well as how to use them properly. Improperly using an engineering control actually puts one using it at more risk. Proper attire is also very important. For example, closed-toed shoes protect against sharp needles. Just as important as having physical barriers and mechanisms for neutralizing sharp materials is to know the procedure being performed. Becoming familiar with the procedure will help to mitigate errors when the procedure is being implemented. Finally, exercise universal precautions. This is simply the assumption that any person or specimen potentially contains infectious material. By following this assumption, one is less likely to skip following a crucial step, such as donning appropriate PPE, etc.